Good day. We're gonna tackle for today is our week 6 and 7 lesson on our SSP 111 for our learning outcomes. First, we're going to discuss the sexually transmitted diseases. Second is to be able to identify the different sexually transmitted diseases. So before we start our lesson, let me introduce myself. I am Rachel Kutay and here are my members. Kenjan Villaplana, Christine Lumacat, Aljacid Benito, Ivy Campomanes, John R.V. Ramos, Juliana Balbon, Mark Gonzalez, Carl Dignadice, Trixie Duque. And we are from BSTM 1A. And I hope after our discussions, you have gained knowledge about our lessons.
Sexually transmitted diseases. Hi everyone, I'm Kenjan Villaplana. My topic is all about sexually transmitted diseases. Sexually transmitted infection or STIs, also known as sexually transmitted diseases or STDs, or venereal diseases or VD, are diseases that are passed on from one person to another through sexual contact. The infection can be passed on through vaginal intercourse, oral sex, and anal sex. Some sexually transmitted infection can spread through the use of unsterilized drug needles from mother to baby during childbirth or breastfeeding and blood transfusions. Sexually transmitted infections have been around for 1,000 of years. The genital areas are generally moist and warm environments, ideal for the growth of yeasts, viruses, and bacteria. Microorganisms that exist on the skin or mucous membrane of the male or female genital area can be transmitted, as can organisms in semen, vaginal secretion, or blood during sexual intercourse. Here are the examples of sexually transmitted diseases. Include chlamydia, chancroid, crabs or pubic lice, genital herpes, genital warts, hepatitis B, human immunodeficiency virus or HIV or acquired immunodeficiency syndrome or AIDS, human papillomavirus or HPV, trichomoniasis or parasitic infection, molluscum contagiosum, pelvic inflammatory disease or PID, syphilis, gonorrhea, and trichomoniasis or trich. Sexually transmitted infections are more easily passed on during unprotected sex without using safer sex options like, for example, condoms, dams, and sanitizing sex toys. Some infections can be passed on via sexual contact but are not classed as sexual transmitted infection. For instance, meningitis can be passed on via sexual contact, but usually people became infected for other reason, so it is not classed as an STD. The WHO or the WHO means World Health Organization estimates that worldwide there are more than 1 million new STDs acquired each day. People aged 15 to 24 acquired half of all new STDs, and 1 in 4 sexually active adolescents female has an STD, such as human papillomavirus or chlamydia. Compared with other adults, individuals aged 15 to 24 have a higher risk of getting STDs. However, STD rates among seniors are increasing.
my name is Christine Lumakad and our topic for today is chlamydia. Chlamydia is also known as a chlamydia infection. Chlamydia is an STI caused by the Chlamydia trachomatis, a bacterium that infects humans exclusively. Chlamydia is the most common infection cause of the genital and eye disease. Globally, it is also the leading bacterial STI. To the CDC Centers for the Disease Control and Prevention, in 2015, nearly 3% of girls aged 15 to 19 had chlamydia. And with chlamydia do not usually have signs or symptoms. If there are any, they are usually non-specific and many include are the following signs and symptoms of chlamydia: the cystitis, a change in vaginal discharge, mild lower abdominal pain, pelvic pain, painful sexual intercourse, either intermittently or all the time, bleeding between menstrual periods.
Chancroid. Chancroid is also known as soft chancroidiocosmal. It is a bacterial infection caused by fuzzy gram-negative Streptobacillus haemophilus ducreyi and is characterized by painful sores on the genitals. It is only spread through sexual contact. Infection rates are very low in rich countries. It is more common in developing nations, especially among commercial sex workers and some low socioeconomic groups. This is due to the lack of access to healthcare services, the stigma attached to seeking help, a lack of sexual health awareness, and other factors. In 2015, just 11 cases of chancroid were reported in the United States. Chancroid increases the risk of contracting HIV, and HIV increases the risk of contracting chancroid within 1 day to 2 weeks after becoming infected. The patient develops a bump that turns into an ulcer within a day. The boils can be from 1/8 of an inch to 2 inches across. It is very painful. May have well-defined undermined borders and a yellowish-gray materials at its base. If the base is grazed, it will typically bleed. In some cases, the lymph nodes swell and become painful. Women often have at least 4 boils, while men usually have just 1. Males tend to have fewer and less severe symptoms. The boils typically appear at the groove at the back of the glass penis. In a circumcised male or in females, the labia minora or the small inner folds of the vulva or porchette or the thin fold of skin at the back of vulva. Chancroid is also treated with a 7 days of erythromycin, a single oral dose of azithromycin, or a single dose of ceftriaxone.
Crab's pubic lice. Varices pubic lice manifestations are primarily spread through sexual contact. Pets do not play any part in the transmission of human lice. The lice attach to the pubic hair and might also be sometimes found in the armpits, mustache, beard, eyelashes, and eyebrows. They feed on human blood. The common term crabs from the appearance of the lice with their crabs-like claws and body shape.
Genital herpes. This STD is caused by the herpes simplex virus HSV. The virus affects the skin, cervix, genitals, and some other parts of the body. There are 2 types: HSV-P1, also known as herpes type 1, HSV-2, also known as herpes type 2. Herpes is a long-term chronic condition. A significant number of infected individuals never show any symptoms and do not know about their herpes status. HSV is easily transmissible from human to human by direct contact. Most commonly, transmission of type 2 HSV occurs through vaginal, organ, or anal sex. Type 1 is most commonly transmitted from share straw, utensil, etc. in most cases. The virus remains dormant after entering a human being. In other words, there are no symptoms. The signs and symptoms associated with genital herpes, if they do appear, may include blister and ulceration on the cervix, vaginal discharge, pain on urinating, fever, generally feeling unwell, malaise, cold sores around the mouth for type 1 HSV. Also, there may be red blister. This can be painful, especially after they burst, and leave ulcer on the external genital area, rectum, tights, and buttocks.
Hepatitis V. These sexually transmitted diseases is caused by the hepatitis B virus, or known as HBV. It is transmitted through contact with infected semen, blood, and some other body fluids. A person can become infected by having unprotected sex, using an unsterilized syringe, being accidentally pricked by a sharp object, drinking infected breast milk, or being bitten by an infected person. The patient's liver swells and they can suffer serious liver damage as a result of the infection, which can eventually lead to cancer. In some cases, the disease can become chronic. Blood donation centers always check to make sure the donor's blood is free of the hepatitis B virus. HIV and AIDS. HIV is the virus that causes AIDS. Put simply, HIV is the virus while AIDS is the illness or disease. When a person has AIDS, their immune system is altered and they become much more vulnerable to infections and diseases. As the disease progresses, this susceptibility worsens. HIV exists in the body fluids of a person who has HIV, such as semen, blood, breast milk, and vaginal fluids. HIV can be transmitted through blood-to-blood contact, which may occur during sexual contact, vaginal, oral, or anal sex, blood transfusions, breastfeeding, childbirth, and the sharing of infected needles.
Trichomoniasis. Trichomoniasis is a common sexually transmitted disease that can affect both males and females. However, women are more likely to experience symptoms. The infection is caused by a single, called protozoan parasite, Trichomonas vaginalis. For women, the most common site of infection is the vagina, while for men, it is the urethra, urine canal. Transmission may occur either by penis to vagina sexual intercourse or vulva to vulva contact, while women may be infected from either male or female sexual partners. Men nearly always become infected from having sex with women, not men. A woman with trichomoniasis is more likely to become HIV infected if she is exposed to the virus. A woman with trichomoniasis and HIV is also more likely to pass the HIV virus onto other sexual partners. Signs and symptoms to trichomoniasis include vaginal odor, vaginal discharge, pain or discomfort during sexual intercourse, pain when urinating.
Syphilis. Syphilis is the result of infection by Treponema pallidum, a bacterium. It is transmitted by sexual contact. The infected person has a syphilis lesion. An infected mother can pass on this STI to her baby during pregnancy, which can result in stillbirth or serious birth defects. An infected person when exposed to HIV has a higher risk of becoming HIV positive. There is a 9 to 90 day incubation period after initial infection. Average time 21 days before the initial signs and symptoms of the disease emerge. Each syphilis stage has characteristic signs and symptoms. Some infected people have no signs, while for others they may be mild. In some cases, even if signs and symptoms go away, the bacterium is still there and can cause serious health problems later on.
Gonorrhea, also known as the clot or the drip, this sexually transmitted bacterial infection usually attacks the mucous membranes. Gonorrhea is the second most common sexually transmitted disease after chlamydia. The bacterium, which is highly contagious, resides in the warm and moist cavity of the body. The majority of infected women show no signs or symptoms. If left untreated, females may develop pubic inflammatory disease. Males may develop inflammation of the prostate gland, urethra, or epididymis. The disease is caused by Neisseria gonorrhoeae. The bacteria can survive in the vagina, penis, mouth, rectum, or eye. It can be transmitted during a variety of sexual contacts. As soon as a person is infected, they risk spreading the bacteria to other parts of their body. Somebody may be inadvertently rub their eye and spread the infection. This prolongs the treatment period. A mother can pass the infection onto her baby during childbirth. Signs and symptoms of gonorrhea may appear from 2 to 10 days after initial infection. In some cases, it may take 30 days. Some patients have such mild symptoms that their infection is mistaken from something else, such as yeast infection. Males may have the following signs and symptoms: burning during urination, testicular pain and or swelling, a green, white, or yellow discharge from the penis. Women are less likely to show symptoms, but if they do, they may include spotting after sexual intercourse, swelling of the vulva, vulvitis, irregular bleeding between periods, pink eye conjunctivitis, pain in the pelvic area, burning or pain during urination. If the rectum becomes infected, there may be anal itching, painful bowel movements, and sometimes discharge. When transmission occurred from the oral, there may be burning sensation in the throat and swollen glands.
Scabies. Scabies is a contagious skin condition caused by Sarcoptes scabiei, a tiny mite. They burrow into the skin and lay their eggs. The patient develops a skin rash and experiences intense itchiness. People with scabies are often unaware of their condition for several weeks after initial infection, which means scabies infestations spread rapidly. Scabies is the most commonly transmitted through close body contact, such as holding hands for a long time or sexual intercourse. Hugging a person who has scabies or simply shaking hands with them is unlikely to lead to transmission.
Prevention. Have safe sex for each sexual act. Use a new latex condom, whether it be oral, vaginal, or anal sex. Avoid using an oil-based lubricant such as petroleum jelly when using a latex condom. Non-barrier forms of contraception, such as oral contraceptives or intrauterine devices, do nothing to protect people from sexually transmitted infections. Abstain. Abstaining from any sexual act is probably the most effective way to avoid becoming infected with an STD. Be faithful to one uninfected partner. Be in a long-term relationship with a person who is not infected and remain faithful. Vaccinations. There are vaccinations that can protect from eventually developing from types of cancer caused by 2 STIs, the HPV and hepatitis B vaccines. Check for infections. Before sexual intercourse with a new partner, check that the partner or yourself have no STDs. Drink alcohol in moderation. People who are drunk are more likely to engage in risky behavior. Avoid using some recreational drugs, which may also affect judgment. Explain you want safe sex. Before engaging in any sexual act with a new partner, make it clear that you would only consider safe sex. Education. Parents, schools, and society in general need to teach children about the importance of safe sex and explain how to prevent becoming infected with an STD. Education should also include information relevant to the LGBTQ population. Contraceptives are products used to prevent pregnancy by women and men. Each individual has their own choice in what contraceptive they want to use, so you must assess their preference first before providing the best contraceptive for them. A pregnancy test must be performed first to make sure that the woman seeking for birth control is not presently pregnant. Assess for the OB history of the client, any past sexually transmitted diseases, the status of the past pregnancies, and if they have used a family planning method that did not turn out effective. Assess subjectively the needs, preferences, desires, and feelings of the client regarding family planning. Assess the sexual practices of the client, the frequency, the number of their sexual partners, and if they have any allergies to latex.